This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
So Joey Levy is on this call as well, as far as I know. My name's Doug Hunter. He and I are both the chief residents. We are at Albany Medical Center for the PM&R residency in upstate New York. So just to kind of give you a little bit of information about our program is primarily why we are here. We'll try to get through this PowerPoint in a timely manner so that we are open to your questions. So first thing to make big notice of as you're looking at our program is the fact that it's very, very small. We only have 2 residents per year. Depending on how you judge this, it's either a very good thing or a very bad thing. My argument would obviously be towards that it is a very, very good thing. Just keeping in mind the exposure that you're able to get in a very small program. But moving on, we are also a categorical program. You will only have to match once. You only have to move once. Obviously advantages and disadvantages, but our prelim year, it's a year with the Department of Internal Medicine at Albany Medical Center, and it's a very, very good internship year. Our inpatient time is comprised for the most part during our PGY2 year. However, we do have 2 months where we go back to inpatient time as a PGY3. And then the rest of it is essentially all outpatient stuff. We have made a point of just letting everybody know we do not have any in-house call. In fact, our call is very, very manageable. We do a total of, it's over 3 years, it ends up being 26 weekends that you're going to be on call. So if you're doing the math, I mean, you're really on average on call like once every 6 weeks over a 3-year span. You do more call in the beginning, less call towards the end. So it gets much, much better the further you move on throughout the program. A little bit of information just about the main teaching hospitals that you're going to be a part of. So the first one is Albany Medical Center. It is the only academic medical center in this part of the state and kind of this area of the country. We get a lot of patients from neighboring states, Vermont, Massachusetts, even New Hampshire. It is the busiest level 1 trauma center in New York State. We see about 85,000 visits annually. You'll get a lot of exposure to that, especially during your first year as an intern, as well as you're moving on through the outpatient world. We get people, they'll travel multiple hours to access the services that we offer. And then our inpatient time is done at a neighboring rehabilitation hospital named Sunnyview Rehab. It has been one of the US News top rehab hospitals the past few years. It's a very big hospital considering the part of the country that we're in. And again, we're pulling in patients. They'll have them transported, even 4 hours away to get to us. We do have dedicated services for stroke, TBI, spinal cord injury, amputation, cardiopulm, and ortho. And we also will have board certified and fellowship trained physicians in TBI, spinal cord injury, stroke, and all of those subspecialties that you're going to be finding on your inpatient rotations. Really is very much state of the art. Has a lot of the really cool new technologies, EXO and all of the other fancy stuff that patients like, that residents like. So that won't be lacking in your training at our program. Our outpatient rotations, primarily done in your 3rd and 4th year. There are a few that are considered a part of the core where you have to do them, things like EMG, things like P&O. But we actually have a very, very large amount of kind of our own elective time. You have about 3+ months per year where you can basically choose what you would like to be doing with it. That I believe is important because there are a lot of different areas in PM&R and they vary widely. So not only having the ability to get exposure to what you think you might be interested in, but just making sure that that's what you want to do. Like if you want to say go into sports medicine, or you want to do peds, or you want to do any of those other things, giving you enough time to actually say, you know, after 3 months, this is for sure what I want to do in my third year. Just mentioning the fact that we have a lot of one-on-one time with our attendings, and just referring back to where we were as far as how small of a program that we are. And so just off the top of my head, and Joey can correct me if I'm wrong on this. So our core PM&R faculty, so our program director, she's general rehab. We have another generalist who's also RMSK trained. We have a brand new sports medicine attending that's joining us. We have a PM&R pain attending that's a part of our core faculty there at AMC. We have multiple attendings that we do EMGs with, including a couple private practice guys who teach a lot of the AA&EM courses. We have private practice pain that we can rotate with. And then over at Sunnyview, we have sports medicine trained, pain trained, pediatric outpatient stuff. So, I mean, just off the top of my head, it's anywhere, if I'm remembering right, up to 15 different attendings that you can be rotating with during your elective time. And there's only 6 residents, which means you're never fighting with any other residents to get your procedure numbers. You're never fighting with any of your other residents to get clinic time. We have really, really robust spasticity management where, you know, I think it's like 20 injections for Botox that you need to graduate residency. And I'm pretty sure I had mine, like those numbers within like the first 2 weeks of starting outpatient. Will easily hit all of my EMG numbers, already hit my spine numbers. Like there's just a lot to be said about having that many people that you're able to get exposure to. And then the other thing that I think is always good to mention is the fact that while we do have access to kind of the academic side at AMC, we also see a little bit more of the private practice side with some of the other attendings that we're able to rotate with. So you get a look into different practice models, types of practice of PM&R and things like that. So our didactics, we do very, very well on the boards historically. I don't think Joey and I are planning on having that change anytime soon. We do, every year we do ultrasound and fluoroscopy cadaver workshops with both our RMSK attendings as well as our pain attendings. And so those will, you know, incorporate, I think it's 10 or 12 different afternoons throughout the year. So you're getting a lot of really good exposure and practice that way. We do have weekly didactic time, which is protected for us every Wednesday afternoon. We do journal club, grand rounds, and we have a lot of really good guest speakers from different departments, neurology, rheumatology, oncology, things like that. So resident life. So we are in upstate New York. It's big enough to have a lot going on, but not so big that cost of living is out of control, especially if you're coming from anywhere like Boston, New York City, places like that. Starting salary this year for the PGY ones was almost $70,000. Those numbers typically, at least since I've been here, have gone up every single year. Good benefits package. You do get a meal stipend. There's a free in-hospital gym facilities. And as I had mentioned, you're really only on call for PGY2 through PGY4. You're only on call for about 26 weekends throughout that entire time, which means that there's a lot of stuff to do. So for all of you people that love cities within, you know, it's within about 3 hours, there's New York City, Boston, Montreal. They're all kind of right there for people. And a lot of people do day trips and weekend trips. Anybody who's really outdoor geared, Adirondacks are right next to us, Green Mountains, White Mountains, the Berkshires are right here as well. That's where I was all day today, just mountain biking on one of my many free weekends. And so, yeah, there's a really, really good work-life balance that we have going here, and it's a very nice place to live. And then just as a kind of final selling point on our program, just asking yourself where you would like to be in 5 years. What I can tell you about this program is traditionally, at least up until last year, we always had a class of 2, and it seemed like one person would go private practice, one person would go fellowship. So if you're looking at programs and, you know, you notice that like nobody seems to even have everything down to go private practice right out of residency. I would argue maybe find somewhere where you'll feel confident to go right into private practice if you choose to do so, or right into clinical practice. I won't say private practice. However, if you're looking to go into fellowship, you can too. Our chiefs last year, one went into cancer rehab, the other one into ACGME pain. You're going to be graduating from here with really good exposure to pretty much every area of PM&R. I just finished up my my inpatient time. The last 2 months I was there, May and June. Ran the TBI service by myself. Felt very, very confident. It's not what I'm going to pursue in the future, but felt like, you know, if I needed to do this is definitely what I could be able to do as well. You're going to hit your numbers very, very easily. You're going to get all the hands-on procedural experience that a lot of people get into PM&R for. And you're going to be ready to really be a doctor when you finish up here, regardless of whether or not you choose to do a fellowship afterwards. So just always something to consider, okay? And we'll move on to questions. If you need our emails, they're right here. I'll leave this up for just a second. But yeah, we can move on to the questions. All right. So I'll answer the first question about how electives are structured. Yeah, you absolutely get to choose whatever field you're interested in. There's tons of flexibility to the point where you can do different things on different days. Like I've had some elective months where like I would basically go through different attendings schedules and say like, oh, this sports guy has a bunch of shoulder stuff that I want to see today. Spine person, like spine attending tomorrow has a bunch of spinal injections. I'll go with her. So yeah, there's a huge amount of flexibility where you can go, I mean, day-to-day flexibility, and you can even go to the point where you could like choose a really good morning clinic in general rehab, and then there's a really good sports clinic in the afternoon that you can go do. Definitely have done that before. And moving on to the next question, any IMGs in your program? I am not sure if we have in the past. I know at least since I've been here, I believe everybody has been a US either MD or DO. And then from Javier, medical coverage, as far as I'm guessing what you're getting at is on our inpatient time, whether or not there's an internal medicine service. So I'll answer to that. So there is an internal medicine service that is available in the hospital, but PM&R is the primary. Now, what I will say is I will always argue for the fact that you should go somewhere where you're still the primary service, because that is just how some hospitals function. And it's much, much easier to go from the primary service to the consulting role than it is the other way around. If you were to train at somewhere where you're just consulting and then you're expected in a future job to be the primary, you will be a better doctor if you're the primary when you're thinking about everything, but there is but there is availability for internal medicine. Has anybody done OMM electives? I do not know if anybody's done a pure OMM elective. I'm an MD, but I did sit in on OMM with one of our attendings who does that, just to see kind of what it's all about before I, were to refer patients to it. So there's not like a set OMM elective, but one of our attendings who's a sports trained DO does do OMM. Any other questions? So yes, there is dedicated pediatric exposure. You do your pediatric rotation as a fourth year. So, and it's a really good mix of quite a few different multidisciplinary clinics. And then you also do some rotation time, obviously with PM&R. and as well with pediatric neurosurgery, where you're kind of looking at the entire scope of treating the kiddos with things like CP and the like. And that's a month-long rotation as a 4, just to let you know. So within the program itself, there is not a lot. If you're looking for that, it is around. So Sunnyview has a big presence in that. And then I'm still toying with the idea, just because, so where we are in Albany, we're actually really close to some of the bigger ski resorts up in Vermont. So I'm debating whether or not I get involved with the Vermont Adaptive Sports this upcoming winter, but still not sure yet.
You guys have about 5 more minutes for any remaining questions.
Yes, we absolutely do teach medical students. We're obviously, a lot of our 4th years right now are on their elective rotation, so we do a lot of that. So yeah, if that is something that you're looking for. And then we also are involved in a program of mentorship where we try to kind of link up different residents and attendings with medical students who are interested in PM&R. So that is also an available thing towards you. And then this year, and I believe it will be ongoing, one of our attendings, Dr. Miller, she also teaches, so she's PM&R RMSK. She teaches at the medical school. She does part of their neuroscience courses and their ultrasound curriculum, as well as our ultrasound curriculum. And you do a dedicated session for all of the medical students when they are first years, to give them exposure to PM&R and kind of what we do. So you get the whole breadth from MS1s who have no clue and think that you're a physical therapist, up to, you know, the MS4s that are applying into the specialty.